Do not treat these cases with benzodiazepines. If you have any suspicion or knowledge of liver disease in a case that is seizuring, I would not treat them with benzos. I would treat them with ditomidine or one of my other seizure medications for control and prevention. And some of these can also be given in my first assessment and treatment of that seizure initially. Phenobarbital can be given orally or IV. If you're dealing with an adult horse, you probably won't ever be doing it IV because it's so expensive. Potassium and sodium bromide is another option. So I've always used potassium bromide, but sodium bromide might be more available depending on the day of the week. It's a bit of a bigger dose, and we aren't starting them off on this by itself. So you will use this in addition to, say, your phenobarbital. And then as time goes on and you're trying to wean them off of the phenobarb, you keep them on the potassium bromide and you keep them on that longer term. And that can be enough to control your seizures if you need that long-term control. And then the sodium pentobarbital, this one is a little bit scary, but you can use this for goal one, stopping that seizure if you need to, and for short-term control. I would not use this long-term at all. I would use this for a day, ideally, if you need it. Other seizure medications you can consider that aren't maybe your first go-to, you can consider gabapentin, and then phenytoin is another one that you can think about. But again, this wouldn't be my first choice reaching for this. I would be trying other things first.